all come webinar for Oregon's 1115 Medicaid waiver. Hopefully you are here because you're interested in learning more about the work that we're currently doing with our Medicaid waiver. We have a little bit of housekeeping for the folks who are here live today, making sure that we're using the chat function to submit questions, comments, and making sure that we are able to be interactive, but also there are quite a few people who are here, so we want to do so in an organized way. We do have a hand raising ability and we can call on you, and we are also recording today. One last call for anyone who wants to access live captioning. You can do so by clicking the CC button built into Zoom or by looking at the URL that, oh, I just realized I put in the waiting room instead of our actual room. So I just put that in as well. We have a few things to go over today. Very soon, I'm gonna pass the mic over to Steph Jerem, who's going to be giving most of these updates, but I'll set the stage. We're gonna do a quick overview of what we mean when we are talking about the 1115 Medicaid waiver here in Oregon, making sure we're all on the same page. Then we're going to talk about community capacity building funds, which is part of what is built into this round of the waiver and is a grant opportunity that we're really excited to share. We will spend a little bit of time talking about health-related social needs service provider qualifications. And I think we'll be focusing mostly on the pieces that are going to come into play in early 2024, and knowing that all of the things we're going to be talking about today are just one small part of a whole lot of work, a whole lot of different things that are currently happening as we build out our Oregon Health Plan and our Medicaid benefits. So with that said, we also will have some time at the end for Q&A and to make sure that we are continuing to not just talk at you, but also listen and collaborate and learn about your priorities and what you want to hear more about. With that said, Steph, I'm happy to hand it over to you.
Lovely. Thank you, Jessica. Hello, everyone. My name is Steph Jerem. I use she, her pronouns. I am currently serving as the 1115 Medicaid Waiver Policy Director, and I am happy to be back in this space talking to you all. So if you go to the next slide, I'm going to do what we typically do, which is just to do a very brief orientation in case there are some folks who are joining for the first time. What are we talking about? We're talking about the Medicaid 1115 waiver. So what is this waiver? It is related to our Medicaid or our Oregon Health Plan program in Oregon. Every state has to follow a standard set of rules that the federal government sets out related to Medicaid, but states can ask for permission to change how that looks in their own state. And so that is what we talk about with our waiver. It is basically a way for us to say, I know this is how the federal government says we should run Medicaid, but we have some ideas about how to do it differently. We think it's going to provide better outcomes or be lower cost. And so the federal government says, okay, let's try it. And so it is also known as a demonstration waiver. You'll hear that terminology too. We have to renew our Medicaid waivers every 5 years, and CMS, the Centers for Medicare and Medicaid Services, our federal partners in this work, get to decide whether or not they want to accept or reject our proposals. So if you go to the next slide, we have been renewing a waiver since 1994. Different attempts to try and test out new innovative ideas each time. Really focusing on flexibility, providing additional services, and increasing the number of people who are covered by the Oregon Health Plan. And the most recent waiver, the one we're talking about today, was approved starting October 1st, 2022, and will run through September 30th, 2027. Many of the pieces are still in negotiation, and we continue to work really closely with our federal partners as we get closer to the implementation to say, here's what we're thinking, this is what it's going to look like, and they continue to be a partner in this work as we refine what the program looks like. So if you go to the next slide, the goals for this waiver really focused and centered around our efforts to address and advance health equity. And we're doing that in 4 ways here, related to creating a more equitable, culturally and linguistically responsive healthcare system, ensuring people can maintain health coverage. So you'll see lots of efforts to expand health coverage, improving health outcomes by addressing health-related social needs, and ensuring smart and flexible spending around that. So our large changes on the next slide are to extend Oregon Health Plan coverage or eligibility for young children, youth, and adults. For kids up to age 6, that means continuous OHP eligibility and enrollment. Once you are on Oregon Health Plan and you're under the age of 6, you get to stay on until you turn 6. For everyone else on the Oregon Health Plan, so that's age 6 and above, you will have 2 years of continuous enrollment. There is support for health-related social needs, which we're going to talk about later, including housing, nutrition, and climate, and coverage for young adults with special healthcare needs up to age 26. And you'll see here, there are a couple of these that are first in the nation policies, really exciting work in Oregon. And another note is that Healthier Oregon OHP members are also included in all of these benefits. So I just want to make sure that we flag that. You go to the next slide, I will share some of our key decisions and the timeline. We're going to make sure these slides are available on our website. And so you'll definitely have a chance to look at this in more detail. We are, as of today, in November. So looking at that, we are really focusing on completing contract amendments with our coordinated care organizations to put the climate benefits in place. That is all focused on the climate benefits going live in January. We are also working on our capacity building funds and what those agreements look like for distributing funds. We're going to talk about that today. You go to the next slide. You'll see that in early, or I guess mid next year, we're going to continue working on housing. There are lots of contract amendments for our CCO partners because this is all done through them. The contract between OHA and the CCO has to leave space for these new benefits and new expansion categories. And in the midst, we also have rules. So those are Oregon administrative rules. There's going to be lots of updates. If you're staying up to date with these sessions, we'll be sure to notify you when rules sessions are coming and you can weigh in on what that looks like. The goal is for distribution of the capacity building funds through CCOs starting in July of 2024. And if you go to the next slide, you'll see we are all aiming here towards this housing phase 1 going live in November and nutrition going live in January 2025, which may feel like a long time away. And also there's a lot to be done. So I'm going to move to the community capacity building funds. I don't see any questions in the chat, but if you do have questions, feel free to pop them in. We can always pause. I'm going to go a little bit deeper now into the content of the 2 areas we're talking about today. So first is on the community capacity building funding. So what is this? What am I talking about? This is also known as infrastructure funds. You may have heard of that. We've kind of used a couple of different terms and we've heard that this one makes the most sense to the most people. So Oregon has $119 million from our federal partners, from CMS, that is meant to strengthen the ability of our partners and providers in the state to deliver the new benefits that are in this waiver. And so this is going to be our providers of climate, housing, nutrition services, other key partners like tribal governments. They'll all be eligible to receive some of these funds. And the goal is to really get ready for the influx of new patients and new services. The outreach from CCOs, all these providers, is going to be occurring in the early part of next year. So January and February, something to be ready for. There will be common applications. There's going to be a standardized application and budget requests for what these funds look like that will go through the CCOs. CCOs will be reviewing the applications. OHA will have a role as well. And then the aim is to disperse funding beginning July and August of next year. Okay, I see Mel's question. I'm going to go through a couple more slides here and see if those questions get answered, and then we'll come back to them. So these are very text heavy. I know there's a lot of writing on these slides. This is really to make sure the information gets out there. Please continue to look at the slides. This is the role of OHA in all of this. So we are really wanting to connect with the health-related social needs providers. So these are community-based organizations, other organizations, social service providers who are supporting members and accessing the climate services, accessing housing, accessing nutrition. So OHA has a role in all of this as well. We are wanting to make sure that the infrastructure funding, these capacity building funds, are available to the broadest number of providers as possible. We're going to be reserving some of those funds specifically for tribal governments. OHA will also be working to partner with all of you on what the design of these programs look like. So nothing is set in stone. This is really an opportunity for us to hear from all of you. There's lots of spaces for us to do that. We want to promote access to these funds among providers that haven't historically been part of Medicaid and maybe are still serving the priority populations, but have not been connected to CCOs. We want to make sure that the funding is spread across the state, that we're not seeing a major concentration and leaving others without funding. We really want to support the use of the funding in a way that is not burdensome related to reporting and oversight. And we want to have a simple, straightforward application process. So those are all of our goals. That is what we're working towards as a state, just to be transparent. If you go to the next slide, just keep giving you more information on this, and then we'll get to questions. These are the 4 categories that funding will be available for providers. These were agreed upon with our federal partners, and so it's very specific as to how the funding can be used. It can be used for technology purposes. So an example here would be a health-related social needs referral system, or changes to any of your data platforms, purchasing of some equipment. It can be used for development of operational practices. So thinking about how you're going to do billing, what your HR systems may look like. It can be used for workforce development. So there's some time-limited funding for staffing. When you think about like maybe incentives for certain hiring or for workforce training. And it can also be used for outreach, education, and convening. And so designing and producing materials, printing of materials, translation of materials, supporting different convenings. Those are all the different categories. We have lots of examples of what that looks like, and we'll continue to share those. So the next slide really looks at how this is again another description of how the funds can be used. Federal government set those guidelines, and we are planning to distribute those funds to providers. We do have a slide in a few slides that'll go into more detail. So next slide, just continue to share a little bit of the process here. As I described, OHA is receiving the funds from the federal government. We will be providing those dollars to CCOs through what we're calling infrastructure funding. Each of those CCOs will then be running a grant process with the grant applications in their region to distribute those funds to community-based organizations and health-related social needs providers. I'll note that tribal governments will continue to use a separate process. Next slide. The application and disbursement. So outreach is going to begin in the winter of this year, probably December, January, February. And the goal is that funding will be available beginning in summer of 2024. We know that not everybody will be ready right away or may not be interested right away. And so we are anticipating multiple rounds of funding in the coming years to make sure that others will have an opportunity, that this isn't just like first come, first serve. And so really trying to be thoughtful. We know that it's a lot of work to be applying for grants and to be understanding what this program is. We will be working as a state very closely with the CCOs to administer these funds. And the goal here is really to develop each region's capacity to provide the services. This is to provide existing services. I know many of our community-based organizations are already doing this work. This is really just to strengthen their ability to do that. This is also an expectation that CCOs will be conducting outreach and education to all the groups in their regions related to funding opportunities. We will also be working with CCOs to administer, to disperse the funding and to enter into grant agreements and to monitor funding use among all the eligible groups to ensure that there is appropriate use. And so my last slide on this is just for clarity, the following entities that are available that will be able to apply for and receive funds. These are examples. It's not fully limited to this, but you'll see we have tribes and tribal providers, community-based organizations, social services agencies, housing agencies, food and nutrition providers, case management providers, traditional health workers, child welfare, local government, and others that could be approved. So I'm going to pause there and look at these questions and see if they have been answered at all. Okay, so we have a question here about the application and budget for the funds be posted and where will they be shared. So you saw the dates in terms of when we'll be moving forward on this. The overall budget won't be shared until sometime next year. We are working to figure out the best way to distribute the funds across the state. We don't want to rely solely on a per member funding arrangement because we want to be sure that we're building capacity where the need is, not necessarily based purely on the number of members. A good question about how CBOs get on the CCO radar. I know that that's probably something that's a big concern, especially if you haven't been part of a CCO network previously. So we are going to be working as a state to ensure that CCOs are conducting outreach. We'll be partnering with them to make sure that they are communicating that broadly in their region. And we will also be doing our best to communicate that at the state level in case that's where your current access to the state is. So we'll be posting information as we get it as well, just to make sure that there's lots of different ways that folks can connect into that work. Are there specific contacts at CCOs? So this is something we are working on to make sure that CCOs have somebody who will be their point person and can field these types of questions. Totally hear you on the need for that. That is something that will be required in their contract moving forward, but I think in particular for these grants, that will be a big need in the short term. Community capacity funds. How will funds be spread throughout the state? Will each CCO be distributing a certain percentage? Great question. We are still working on that. Would love to get thoughts and feedback. We certainly accept written comments on this if anybody has perspective to share. We are currently working to create an algorithm or a formula that would work throughout the state. So as I said, we don't want to rely solely on the number of members. We want to make sure that in areas of the state where perhaps they haven't had the level of investment, that we are ensuring that this is an opportunity for them to really come up and be able to meet the a more consistent level of services across the state. And so there are other things that we can look at in terms of the service providers, the number of providers in the state, the level of need and risk of their patients, homelessness numbers. There's lots of different pieces that we're considering that would all factor into how funds may be distributed. CCOs will be using that funding to share what's available in a region. But as I said, there will be multiple rounds of this. And so the CCOs will get disbursements based on what is coming in as an application. So we first will be working with the CCO to do their grant application, and then based on what they see come in the door, we'll work with them to distribute the funding. Would these funds be used to turn a non-Medicaid billing entity into one for a housing provider who wants to access this funding for housing services? Great question. I'm going to take that actually as two parts, because certainly that is an option if an organization is interested in becoming a Medicaid billing entity and a Medicaid eligible provider. That could be what the funds are used for. However, we are also not expecting the health-related social need providers to be Medicaid billing entities. We know that that's a huge barrier and a lot of work to actually go through that process. And so that is not going to be an expectation for them to actually be a Medicaid provider, Medicaid eligible provider. And so we'll be using an invoicing system, and it will not be a necessity. But if that is a desire, it could be used for that purpose. So if that wasn't clear, Dana, please feel free to correct me if you had a different question. When you say child welfare is eligible, is there more information on the specific requirements for outreach services so we can apply at the addiction recovery team at the district level? Great question. We are working on the specifics around what child welfare entails and a very specific definition. Don't have it in front of me, but I know we talked about this related to both contracts and rules. And so I may need to get back to you or see if anyone else can provide that. But we are certainly wanting to make sure that that is clear to those who are working with those populations. Where should organizations post written comment on how funds are distributed? You can send that. We have information at the end about our email address, our email address and questions. So you can certainly share it to that with any thoughts and perspectives. And we will make sure that that is part of our consideration. We also have the Oregon Administrative Rules open for comment right now. And so we'll make sure to include that link as well. If there are any comments related to the rules, we welcome that feedback. Is there a list of CCOs and the regions that they serve? Yes,
I'll pop in to say we have put a few links in the chat in response to that.
Great. Okay, thank you. I know there's a lot of questions, so I'm going one by one. Jessica, if you want me to move faster or do this differently, please feel free to let me know.
I was about to say, if you'd like someone to talk to, I can start reading them out, but you're doing great.
Okay, thanks. Okay, should CBOs reach out to CCO community advisory councils to start building relationships now? Is that the correct group to connect to for this funding? Great question. I always think that it's really valuable to connect with a CCO's community advisory council. I think they have a really great pulse on the community and the experience of OHP members within the community. And so I think it's always great to tune into them and become more involved. I don't know what the role of the community advisory councils will be in each CCO region. It will likely look different. And so in some, they may be very involved, and in others, they may not be. So I think there's we'll have to be working with all of you on who the point of contact is. And I think that's something that OHA can commit to, is identifying who the point of contact would be at the CCO for those who are interested in these funds, and sharing that. Lots of links, great, thank you. Would community health workers at a for-profit pediatric clinic be eligible to apply? I think we need to learn a little bit more about what that entails, because this is going to go to the community, to the organization itself. So if the organization is providing these services, then yes, they would be eligible. Individual providers, I'm not sure, but depending on what that relationship looks like, we could certainly have those conversations. Okay, email initiative. Lovely. Do we know if the waiver applies to the COFA Premium Assistance Program, and can CBO servicing COFA citizens apply for and use the funding? I don't know if anyone else on the phone or on the call knows the answer here. My understanding was, I actually don't want to speak out of turn and say anything incorrectly. So this is something that we should get back to you on.
Yeah, good call.
Thanks. Okay. A standard application. Do we anticipate standard scoring criteria? Great question. Would love to know if you think it should be standard scoring criteria. Oh, thank you, Sean. All COFA communities are eligible for full OHP benefits. That's great. That was going to be my response. So I'm happy that that was confirmed. That's right. It doesn't exist anymore. That was my understanding too. Will there be an intermediary billing entity? So I think this person is talking about the actual services, the service provision, not the capacity building funds. For the actual services, yes, there will be an intermediary billing entity. It will either be the CCOs in your region, or it will be our OHA's contracted fee for service third party entity, which is like Comagin or KeyPro right now. So those would be the billing entity in your region. Okay.
I think we might be ready to move on.
Okay. We love these questions, really helpful to us to understand where there's a point of confusion. Yeah, that's great. So thank you. Okay. So next, we're going to move into the service providers. So, I mean, this is almost maybe, I'm realizing now we should have maybe switched these so that we could really get into some of this before we talked about the capacity building grants, because I think it's helpful to know what the services are before we talk about why you may need capacity for them. So what are health-related social needs? These are the social and economic needs that impact an individual's ability to maintain health and well-being. So these are also, we talk about them as social determinants of health. They are areas outside of health or a doctor's office that still impact somebody's health and well-being. So things like access to housing, ability to pay for utilities, accessible and reliable transportation, and access to healthy and affordable food. In our waiver and in our agreement with the federal government, we secured new services related to housing supports, nutrition supports, climate related needs, and outreach and engagement. You go to the next slide. This is our overall funding components. If we could do, there you go, thank you. So I already mentioned the $119 million. These are for grants to build capacity in our state to provide the services. And then we have 900 million available for the actual services to individual OHP members who are eligible. And so this will be distributed across the whole time of the waiver, which goes to 2027. Just over $1 billion. So very exciting to bring that into the state. For the providers themselves, when we think about who's actually doing this work, our goal here, and we covered some of these already, which is great. The providers will need to work with a CCO or fee for service to invoice for the services and to be recognized as a service provider in the region. As I said, that registration process is still in development. Certainly welcome feedback. If anybody is like, please sign me up, I'd love to be part of this conversation and help, let us know. You do not need to be enrolled as a Medicaid provider unless this is something that you are desiring to do. We know that that is quite a lot of work and could be a deterrent for folks and organizations to be involved. And we are in process working on how we're going to be communicating about all of this. Some of the things that are questions for us is to make sure that there's not duplication in all the different providers, or that you know, if someone is going to get housing here and then they're going somewhere else, how are we making sure that that experience is not being duplicated? We need to make sure that we're tracking referrals. So if they walk in the door and they get a referral, how is that actually being tracked? How are we closing that loop to let the original provider know? And then we're also looking at subcontracting, because we know that that is a desire of some of our larger community-based organizations and providers. Also maybe subcontracting out different components of what this work looks like. So maybe all the invoicing for multiple CDOs goes to one entity. So those are the things that are in development. This is the current draft in terms of the qualifications, the minimum qualifications to be a HRSN provider.
Thank you.
So they have to be ready to serve eligible populations. That's partly why we are doing capacity building funding in advance of the service. Have strong community relationships, have the ability to provide culturally and linguistically responsive and trauma-informed service delivery. They would need to have the appropriate business licensing or accreditation that is required. Be able to receive referrals and then report on the status of that. Be able to invoice for services, demonstrate a history of responsible financial practices, and comply with all reporting, oversight, and business registration requirements. And so this is what the expectation would be a provider. We know that not everyone is there yet, and that's why we have the 119 million for capacity building. So if this is something that an organization is saying they want to be part of, that capacity building fund will help them get to that level. I'm going to go through what we know for climate. That's where we've worked the most so far. And so the provider and vendor requirements for climate is that they must have experience providing medically necessary climate devices during a significant weather event, high intensity time, that they're able to distribute things on time. The ability to store and distribute devices prior to or during a significant weather event. So we want to make sure that these devices are accessible. Again, the devices are air conditioners, air filtration devices, heaters, generators, and refrigeration units or coolers. And then lastly, they have to have the ability to effectively and safely deliver these devices to members. So that is for climate. That's an example of where we're at. We've done the most in this space because they are starting in January. And then if you go to the next slide, the outreach and engagement provider requirements is that they must know principles and processes of the services that they're meant to be doing outreach for and engaging the populations that are covered by these services. And they must also know information about other services to really facilitate connection to all the available resources to a member to meet their needs. So yes, think we're just about out of time. So we will field more questions. You can put them in the chat. You can also raise your hand. We welcome participation. So is there a plan for an intermediary billing entity? I think that, oh, that came out of the other space. We have both a Q&A and a meeting chat.
We got to keep you on your toes.
Yeah.
Thank you.
Okay, on minimum climate providers, are these expected to be regional hubs or would each CCO region have their own? What happens if there isn't a provider that meets the minimum qualifications in a particular region? So in this case, we are working with CCOs, OHA, and the Oregon Department of Human Services are also both actively engaged in ongoing conversations with CCOs about what that looks like. In cases where the CCO doesn't have the ability, they do have the option to be contracting back with the state to be supporting and maintaining a storage facility. So as I said, that's kind of in process, but we hear you. There certainly will be areas where we just don't have that structure in place in a region, and we're committed to ensuring that these services are available throughout the state. One of the things I didn't mention, but is a really important component of all of this, is that these services are actually benefits, which is very different than how they've been shared in the past. If you're familiar with any of our, I know it's confusing, but there was an HRS, programs we've had in place that we've learned so much from that supported the use of flexible funding for individuals. We're really building on that, but now it is a benefit. And so eligible individuals are able to appeal if they're not receiving the benefit. And so we really have a responsibility to make sure that this is available and accessible around the state. How and when funds for outreach and engagement will be dispersed. So these are going to be services that are, let's see, after. Go back one more. So these are services that CCOs will be responsible for providing, and they will be contracting with outreach and engagement partners in the region to provide the services in most cases. I know we are kind of going back and forth between talking about the capacity building funds and the disbursement there, and then also the services themselves as a benefit. And so the outreach and engagement funds are actual services that will need to start being funded. You can look, I don't remember actually if it's in the rules related to some of that, but I know that there are components of outreach and engagement that are in the rules. So I think we included that link, and you can see a little bit more detail there. Flyer or information regarding the climate services that we could share with participants and partners. Great idea. I don't know that we have a flyer, but we can talk amongst our team and see if that's something that we could start to provide.
I'm here to interrupt and say that we are working on information and hopefully a flyer. And I'm not sure about the timeline for that, but it is something that's underway.
Great. Thanks, Jessica. Let me clarify. So there's all the outreach and engagement. Okay. We should clarify terminology. So when we talk about the outreach and engagement benefit, that is a service going to members. CCOs will contract with outreach and engagement providers to do that work, to make sure that we are connecting with eligible members around the state to make sure that they know that these services are available to them. That's what we're really talking about when we talk about outreach and engagement. It is a service, but we know that CCOs will be providing that. I think you're also thinking potentially about the outreach and engagement that CCOs need to do to support the building of their provider network. that is also something that is ongoing, and we are working on that happening in December and January. So perhaps we can clarify some of that terminology. The fee schedule, there is a draft fee schedule for climate, and there is also a fee schedule. We have not yet solidified any fee schedule for housing or nutrition. Desire to have short videos on a new benefit in multiple language. That's pretty cool. You're talking to the right group. You know, there are lots of folks interested in that type of feedback, what's needed. Is the draft fee schedule for climate available? It's a great question. I don't know if we have anyone on who could speak to that. I actually don't know the typical pathway. I've seen it, but I'm not sure what the pathway is for publication of that fee schedule.
It's a good question. I don't know the answer either. Does anyone on the line?
We can get back to you on that one for sure. If you are, looks like maybe you're from a CCO, I do believe that that has been shared in the CCO rates work group. And so perhaps you'd want to get in contact with your lead on rates.
I'm going to do a quick check. I think we've made it through the questions. I also see some great comments in the chat, but I want to see if there's anyone who feels like we haven't addressed your question, or if you want to make sure that we're recording that so that we can bring more news back to you if we don't get to it today.
Jessica, you probably already answered these, but I do see a couple outstanding questions in the Q&A. I know sometimes folks do both the chat and the Q&A when it comes to questions, but maybe you did answer them.
Thanks, Sean. I believe one of them, the astute individual, realized we weren't being as responsive there and put it in the chat. And I think the other one was just to clarify if counties and local public health is eligible for these community capacity building funds. And I did see them listed on slide 19, which calls out the different providers who may be eligible. But having said that, I want to make sure I'm not talking out of turn. Did I get that right, Steph?
Yes. Yep. And we did just get another question about the draft fee schedule for CBOs for nutrition benefits. We have not yet developed those. So we have a lot of work actually left to do. This probably won't surprise most of you, but we have a lot of work left to do on housing and nutrition benefits, really to make sure that we have a lot better understanding of what works on the ground, the current activities, what the needs are, how the services are being delivered. And so all of that is in the coming months, 4 to 6 months, I would say, of really leaning in, making sure that we understand what that looks like. We know that a lot of these systems already exist, and we are really trying to support the existing systems and strengthen them and not come in and create a new program on top of it. And so that's all work to be done in the coming months, given that those benefits go live in November and then the following January. And questions about having an influence on the fee schedule. Great question. I think if that's something, I also shouldn't speak out of turn since I am not the one who is in charge of fee schedules, but I will carry that question forward to our leads in this space and make sure that there are opportunities if they're available.
See, I think we're just about, wow, we're right about on time, which is amazing. Always glad when that happens. I think I will here. I'll navigate us through the last few slides just to close out, knowing that the chat is open and we're also happy to take raised hands. I do want to make sure you all have a few different ways that you can stay connected with us. So I know I've seen this email posted a few times in the chat, but just want to say out loud that if you ever have a question, a comment, or something that you want response on, we do have a shared inbox that we are using, as well as we try to put as much of the information we've shared today, as well as a lot of other good stuff on our website. And we do have an external newsletter that is now live that has a lot of great updates as well. So these are all good ways to keep in the loop, in addition to coming to this monthly event, which we will be repeating with new content. That was a weird way to say it. We're not repeating it. We continue to have them. There is new content each month, and we'll have one in December as well. And we absolutely can put those links in the chat. And I'll quickly navigate to this one just to really take a moment to say thank you. We know that it's not a given that there's going to be over 100 people hanging out with us on a given Wednesday, and that you've chosen to spend your time here with us. And we really do appreciate all of the feedback, the questions, and ways that we can continue to partner with you all. And please let us know how we can be good partners. I'm going to navigate back to the contact information so you have it, and I'll work on getting that into the chat as well. But thank you so much for joining us.
Thanks, Jessica. Bye, everyone.
Bye, all. We can go ahead and stop recording.